County health officials unexpectedly came into the spotlight with the COVID-19 pandemic. Difficult decisions and sudden spotlights have made their complex work all the more challenging. Newswatch 12's Rachel Eiler joins us now live with the Oneida County Health Director, Linda Conlon. Rachel.
Linda Conlon has been a registered nurse for over 20 years and serves as the steering committee member for the Wisconsin Public Health Research Network, in addition to directing the Oneida County Health Department. She joins me now to share her expertise on some of the pressing concerns from our community. Linda, thank you so much for taking the time to speak with me today.
No problem.
So the first question is one of the things with tourism season coming up. As the tourism season continues to grow, there is concern over visitors being tested positive while in Oneida County, but not being counted for. So how does that affect our COVID numbers if they aren't being counted here?
That's a really good question, and we received that question as well. So really, for the most part, people who test positive for COVID-19 will be counted in the numbers for their home county, not necessarily Oneida County. This reporting follows the state statute. The health department, however, is working with our local providers to gather information about people from out of town who test positive for COVID-19 while in our community to determine what follow-up may be needed to happen locally. We do know that COVID-19 is prevalent in other communities around the state and the nation. And we also know that we have COVID-19 in our area as well. And so we really believe that COVID-19 might be more prevalent in our area and in our community than our local data reflects.
So there's been a lot of talk about contact tracing with the visitors coming to the Northwoods. Does contact tracing apply to them, and is it successful?
Contact tracing, isn't really new for all of Wisconsin's health departments. In the case of COVID-19, which is highly infectious and often spread by people who aren't even aware that they're infected, this contact tracing is successful. The problem that we run into is when we have people from out of the area who have not been identified by a positive individual as a close contact.
Right. And a lot of residents, whether it's contact tracing or visitors or they permanently live here, a lot of residents are still concerned with certain regulations such as masks not being worn or social distancing not being abided by. At the same time, while we see this increase in cases in both ours and other counties, should we or even can we make sure that stricter implementations are happening to prevent the spread of COVID-19?
Well, I think at this point, what we really want to concentrate on is everybody doing their part. The question isn't more about should we have stricter enforcement. It is really about can we have stricter enforcement? And at this point, we will not have stricter enforcement. So what we are doing is really having people do their own monitoring, and the more people that use masks, the more people that social distance, the more people that wash their hands, these strategies will keep COVID-19 from spreading, and it is our best chance at this point in time for keeping our numbers low in our community.
And there are talks now of a second wave coming sometime in July, but has Wisconsin even finished their first wave, and how do we prepare for the possible increase?
I think that's a great question, and it's a question that we have actually bounced around ourselves. I think we need to see a more significant downward trend to say that we are done with the first wave. And we definitely expect a second wave, and that is based on science, but we really haven't seen a real flattening and a real decrease in our numbers yet.
Linda, thank you so much again for joining us.